Okay, so we're going to be talking today about naturopathic um, terrain health, and this might be new to a lot of you. And so I'll explain what that means. But this is the philosophy and approach that we take to help heal from illness and disease. Again, a different philosophy overall. I am a naturopathic doctor, and as a naturopathic doctor, I'll explain a little bit what that means in the future. But when we look at who we are, Options Naturopathic, I'm one of the doctors at part of Options Naturopathic, and we're made up of naturopathic doctors and holistic practitioners to provide preventative wellness services, care services to individuals using a naturopathic, what we call terrain-centered approach. As a naturopathic doctor, my education is from an accredited naturopathic medical school called NUNM, or the National University of Natural Medicine. There's about a few accredited naturopathic schools in North America, which means that they've been established to meet certain criteria for the education system. So there's not a lot of them. There's, I believe, a couple in Canada. The one we went to is in Portland, Oregon. There is one in Washington, I believe California, Arizona, and Illinois. So there's a few of them. And what that means is that during this kind of 4-year process, which happens after undergrad, you had prerequisites. Then you have licensing exams to take, depending on the state that you're going to be practicing in. Not all states have licensure, Ohio being one of them. But we do hold licenses to states that have licensure. And whenever Ohio becomes licensed, or certain states none, we will be able to hold those as well. So we have to pass strict licensing exams and then maintain continuing education, which just means every year or two, we have to make sure that we're getting 30 or so hours of extra medical education or health education to keep on top of all the new material and things to make sure that we're staying on top of it, so we're not getting old in our understanding. We are also terrain certified practitioner. So this is a certification from Dr. Naisha Winters, who has developed an understanding of what we call the metabolic approach, specifically to cancer. And we'll talk about that a little bit later in the slides. But this certification, again, requires an intensive study. And then once we go through that, we are able to become terrain certified practitioner. And we'll talk about that. But I first want to emphasize what naturopathic medicine is. In and of itself, it's a distinct health and healing art with the philosophy that the body has the innate or inborn ability to heal itself. We believe that, by removing obstacles, allowing the body to, the environment to be helpful for thriving and stimulating what we call that natural healing force, nature will help heal the body. So what we're looking for is the ability to remove what we call obstacles to healing, obstacles to cure, and really help the body thrive following what we call the laws of nature for health and healing. And so when we remove the obstacles, we give the body what it needs. The body is going to take that and actually know what to do with it, and going to help the body heal and stimulate that process. Help to what we call self-correct the body. And this is, again, unique and different than a lot of other practitioners out there in that philosophy that helps guide us. So we have tenets, or kind of the 6 areas that we look at that guide us for all of our patients. And the first one is first, do no harm. Now, this is one that pretty much all healthcare practitioners should be following, essentially meaning you don't want to do more harm with the treatments that you're giving someone than you do to actually help them get better. So that's the first and foremost. And then the second one, which is really big, is the healing power of nature. And that is what we talked about, understanding that there's that innate ability, what we call the vital force of each individual person to help the body heal. And the second two kind of go hand in hand, treating the cause and treating the whole person. We're really wanting to look at the reason why, as opposed to just looking at symptoms or covering up symptoms to understand, it's not just the symptom, it's just the language of the body. We want to understand what's the root underlying reason for why something's happening. not just that, oh, you have a headache, let me, give you aspirin, right, for your headache. But why is the headache there? What's going on? And then we also want to educate. Doctor as teacher, docere, or doctor itself means to teach. So we want to educate patients in understanding how they got to where they are, as well as, okay, what to do when they are getting a certain sign or symptom that their body is telling them. And then in hopes they will avoid those things so that they can work on preventing future occurrences, future illnesses, and stopping things before they become progressive or worse. That's our guiding principles. Now, as I mentioned before, signs and symptoms of the body are the body's language. And we'll talk about it, but this is very different than society has been brought to believe, as well as conventional medicine. They view the signs and symptoms of the body as the issue, and they target those and go after those. So whether it's a headache, oh, let me give you something for your headache. Oh, you have joint pain, let me give you something for that. You have diarrhea, let me give you something for that. But not really investigating the reasons why, not going deeper to say, why is this happening? The body is trying to tell us something. And there's an imbalance, right? It's the way that your body is trying to help you heal sometimes. So that's the real important thing that makes us distinct. And even some other functional medicine practitioners out there is we're not just wanting to look at a pill for every ill, not just looking at, okay, instead of using this over-the-counter medication, again, I keep using headaches as an example, but instead of using Tylenol, ibuprofen or headaches, let me use this natural botanical or this supplement. While it can be helpful and is generally far safer than those types of over-the-counters, we're still not getting at the underlying reason for why is someone getting a headache, right? Are they not drinking enough water? Do they have a food allergy or intolerance? Do they hit their head and need time to recover? If all we're doing is just looking at the symptoms and targeting those, I'm no better than anyone else who's just, again, giving them someone a natural product to chase the symptoms there. So that's the main thing that really helps to distinguish us, and it really helps with the healing process. When we look at the conventional medicine, we talked about before, they're looking at the signs and symptoms. They're not addressing the reason why. And so this what's lead to kind of a pretty broken system of how healthcare is that we're not working at prevention. We're not looking at educating the patient. We're not looking at why are these things happening. And so we're essentially playing whack-a-mole, right? We have a symptom that comes up over here, let's say joint pain or shoulder pain, and we give something for that, then that shoulder pain might go away. Well, something else comes up in the body somewhere else. We're going to give, let's say stomach pain. We give something for stomach pain. Oh, now we have a breathing issue. So we're essentially playing whack-a-mole and pushing the things around the body, and as opposed to saying, okay, what is the body trying to tell me? Is there something I'm doing? Is there something contributing to this? And then how do we address that? And most all of my patients that come to see me, they're coming to see options because they keep getting sicker and sicker, or they keep having more symptoms. They're not getting answers or help from the conventional, what I would call the sick care model of health, right? And in doing so, they're like, you know what? I'm not getting help and I'm just getting worse. And so those are the predominant people that we see in our office. Now, conventional medicine is great, especially when it comes to emergency situations, right? And the classic examples would be car accidents, broken bones. Don't come to our office, right? We don't have the ability to do that. They're really great at emergency medicines, really great at stabilizing someone, make sure they're not going to die, right? Make sure that they're not going to bleed out. But after that, they're not doing things that help stimulate or promote the healing process. And so after that person gets stabilized, okay, great. How do we then help the body heal? What do we need to give it? What do we need to remove to decrease that, to increase that vital force? And unfortunately, there's a lot of reasons for why the system is set up the way it is, or how it's developed the way it is. Some of the reasons: insurance companies can dictate where someone goes, how often they're seen, how often or how much they'll get reimbursed, and how much doctors will get paid. And so everything kind of shifts when someone else is dictating it, as opposed to the doctors themselves. Pharmaceutical companies, again, they make money off of the medications. There's nothing wrong with making money, but unfortunately, that's the investment in that is going to dictate how they want someone and how they affect it. Hospital systems, again, so the underlying reason for all this is if you get better and don't need to use your insurance or pharmaceutical companies or hospitals, they essentially, they lose your business. They're not going to be making money off of it. So there's no real strong incentive. And that's not to say that, people in medicine, conventional medicine are, wrong or bad. They go with it with the good intention, good heart of helping people heal, but realize once they're in that model, it's not set up or conducive to allowing that to happen. And so what I want to express today is there is another way. There is another way of understanding the body, listening to the body, and helping the body heal. And that's where naturopathic medicine comes into play. Again, it views all those things very differently. So again, the signs and symptoms are the language of the body, and sometimes they're even the way the body is trying to help us heal. And we could talk about that. We want to understand the reason why. We don't want to just put a Band-Aid on it or cover it up, right? Similar to, if your check engine light comes on in your car, you could put black tape over it. You can cut the wires so you're not seeing it anymore, but something's still happening. And so if you're just, ignoring it or removing the sign or the symptom, so to speak, and not addressing the reason why, things are going to get worse in the future and even more serious. What this means is that because we're not a part of the conventional system, we don't take insurance. Insurance dictates who you can go see, but it's also not going to cover the level of care that we provide, because we're really invested in helping and understanding why someone is the way it is. We spend about 75, 90 minutes with our intakes to really get to understand a patient's history, their past, anything that they're going through, to really pull it all together in a holistic approach. Whereas conventionally, they're dictated to have maybe 7 to 15 minutes with you to kind of get all that information together. So insurance isn't going to pay for that. So I want you to think of this, as an investment in the health, not an expense. Yes, things cost money, but when we're talking about investment, you're investing now so that you don't have serious things happening in the future, to really optimize your health overall. We guide you so that as you are learning what we're trying to teach you, you can kind of correct and prevent issues both now and in the future. So we're really, the ultimate business model that we have is, we don't want to see you very often, because we want to educate you and get you to a state of health that you don't have to keep coming see us because you have some issue going on. And we really want to personalize it for each person. So what might work for you may not necessarily be optimal or be recommended for your friend or your neighbor. Some things can be helpful. Foundational aspects can be very helpful. But just because you are doing something for your health doesn't necessarily mean that it's going to be appropriate for your neighbor, even if it's the exact same types of symptoms. What we want to understand is what for each person will help this person thrive overall. And we have ways of doing that we'll talk about. So we talked about this already, but a truly holistic, what we call naturopathic approach, really understanding, not using suppressive therapies just to, diminish the symptoms or signs that are experiencing, really trying to decrease that, what we call the suppressive effects, to really help the body thrive and heal overall. And this next slide really gives you a good feel for kind of where we're at. Health and wellness, it's a continuum. And most people are probably going to be in this area here, 4, 5, and 6. This is where you might not have symptoms, you don't have any diagnosed disease, and this is kind of what we refer to as a false sense of wellness, right? People just think that, well, I don't have any major issues, I don't have any symptoms going on, so I'm healthy. Well, that doesn't necessarily mean that nothing's happening. It just means that you don't have symptoms. And there's a few slides coming up that will explain why that is. But then you might find people more in these, 2 and 3 categories. So you have some symptoms, you have a diagnosis of an illness, and this is where, again, most of the conventional model lies, is in this left side here. Diseases are developing, they're treating them with medications or surgeries depending on what's coming up. But again, all it's doing is chasing the approach going out there. What we want to do, and what we really thrive in, is the right hand side here, where we're trying to educate, help to optimize wellness, and as that continuum grows, as the person becomes more aware of what to do for their health, what not to do for their health, they're going to grow in their understanding, and they're going to go to a higher and higher level of wellness to the end. Optimally, we want people all the way at 10. Really, they're functioning high. They don't have signs or symptoms. They're growing mentally, emotionally, spiritually on all those levels. This is where, ultimately we want to keep striving for overall. So that brings me to, this ultimate question of what is health? It can mean different things to different people, but I like to kind of, put a definition together, and it's probably best to start with what health isn't. And a lot of these things that you see appear here, you might be surprised. Health is not keto or paleo or vegan or the absence of symptoms, eating organically, working out, being gluten-free. These can definitely help you on your road to optimal health. But just because you follow one of these doesn't mean that you are optimally healthy. So one, you might not be following it, appropriately. So you can be gluten-free, but you can still be eating gluten-free sugars and cakes and sodas and all these things. That doesn't necessarily mean you're healthy, right? It's one of those things that might be following an appropriate gluten-free diet might be helpful to someone. But just doing these things in and of themselves doesn't make someone healthy. Again, taking supplements doesn't necessarily automatically mean someone's healthy. So we can't use these as our guide for what health is. We have to understand that these are tools that we can use when used appropriately to help with that. So I'd like to put together kind of a definition, and I didn't put this together, but Dr. Henry Lindlar, who's an old, also a naturopathic physician, but also a medical doctor, put together this definition that I think encompasses a lot of it. So he says health is the normal and a harmonious vibration of the elements and forces composing the human entity on the physical, mental, moral, and spiritual planes of being, in conformity with the constructive principle of nature applied in an individual's life. So this might seem a little bit confusing or perplexing when you first hear it, but essentially it boils down to how are we living our lives in conformity with how nature intended, right? Are we giving it the appropriate food? Are we our relationships harmonious, right? Are we happy with our environment, happy with our job? Are we creating an environment that is conducive to life and health overall? And so it's more than just all the things that I mentioned before. It's more than all these. It's really looking at, yes, we can use these, but looking at it and saying, okay, how do I support myself on all these planes, physical, mental, moral, and spiritual? And how do they, using these in conformity with the laws of nature? And we'll talk about kind of what that means. The laws of nature means how nature intended the body to thrive in health. And this is another definition, not necessarily of health, but really for what most people experience. And this is from Hippocrates. And Hippocrates says that illnesses do not come out of the blue. They are developed from small daily sins against nature. When enough sins have accumulated, illnesses will suddenly appear. And this is how a lot of people view things, is that they seem to, again, in that middle continuum, they seem to be, wait, they don't have symptoms, I'm great. And then all of a sudden something happens and they think, oh, how did I suddenly get ill? Well, it was because over time, there was constantly something happening that you didn't have symptoms yet, but it was brewing underneath the surface, kind of like that check engine light that pops on, say, hey, pay attention, something's going on here. And it might get worse if you don't pay attention to it. So what are these small daily sins? This is, again, that term that's used for essentially going against, again, the laws of nature, going against what's naturally intended for the body. These are all the things that we're probably potentially aware of, but don't really realize how much they're affecting our bodies. These are things, dietary indiscretions, so eating whatever you want, no matter what it is, negative thoughts and emotions, environmental toxicities. These are things in our air, our water, our food, things around us, social and relational toxicities, again, relationships, I talked about polluted air and water. Electromagnetic fields, that's what EMF stands for. These are things coming from cell phones, cell phone towers, the internet, radar, all these things that, again, affect our cells, disrupt our rhythms, stress from work, school, you name it. Medications and drugs, a lot of these can cause depletions of nutrients or cause other things to appear in the body. Poor nutrition, and many more. This is not an exhaustive list, but all these little things that are around us, on us, affect us, these are what would be considered those small daily sins, right? All these things add up overall over time. And over time, you might not notice them, but then they get to a point where they essentially, oh, now we have symptoms happening. I mentioned in the beginning what we call terrain, naturopathic terrain health. So I have to kind of define what terrain health is, and it's not necessarily unique to naturopathic medicine. Other practitioners can use this understanding and philosophy. But terrain is, as the name implies, that internal and external environment that affects your cells, tissues, and your organ systems. So think of all those factors in the environment, inside, outside, around you, the cells, tissues, and organs, that's going to be influencing your physical, mental, emotional, and spiritual well-being. This is kind of that more a simpler way of understanding what Hippocrates was talking about with, Lindlar was talking about when he talked about, okay, what is health? How does that approach it? These are all the factors that are affecting that. And we can take all these factors and what we call our terrain 10, which are kind of 10 big areas that affect our health. And there's these colored boxes represent that. In particular, they represent how they are affecting our cells. And if we get more specific, something called the mitochondria, which is the little powerhouses inside of all of our cells that, again, dictate the health and life of the cell. So when you look at these colored boxes, we have the human blueprint, which is our term for genes and epigenetics. This is a term that, most people say, well, it's in my genes, or that, my family has it, so I have it, right? And there's nothing I can do about it. Well, that's not necessarily true. In fact, 95%, maybe a little bit more, of all chronic illnesses, all illnesses are due to lifestyle, nothing to do with genes. Now, genes and epigenetics, they can play a little bit of a role into how someone's able to recover from toxicities, how they convert certain nutrients. But there's a very, very small amount of illnesses that are truly genetic. And genes, and what we're discovering is what we call epigenetics, what dictates those genes, what they get turned on or off. These genes can get turned on or off based on your environment, based on the foods that you're eating, based on your exposure to certain things. There's a lot of studies that have been done with twins who theoretically have the exact same genes, but grew up in different households, different areas of the country or world, and have different illnesses and outcomes because of, again, their environment. And they have the same exact genes. And so, yes, it plays a small role. And we look at this in certain circumstances because it helps us understand maybe areas that we need to support more than others. But it's not the be all or end all. Then we have, blood sugar, which is a big one, toxicity, gut health, immune function, mind, body, and spirit, which is a really big one, hormone balance. All these factors here influence each other. In fact, you can draw an arrow from any one of these colored boxes to any one of the other ones and back again, because they all influence each other. So as you're addressing one, you're actually going to be addressing a lot of the other ones. But what we want to discover for each patient is what for each person is their main drivers or triggers for what's happening, right? Even if you have the exact same symptoms or signs that are going on, maybe one person's, main drivers or triggers are going to be, blood sugar, toxicity, and gut health. Maybe those are three big ones for them. But someone else who might have the exact same symptoms, let's say fatigue or joint pain or sleep issues, right? Maybe their big drivers and triggers, they might have some of these, but maybe their big ones are mind, body, and spirit, sleep, stress, and hormones. Maybe those are their three big ones that are really disrupted. Now, as I said before, all of these factors in here can also be influenced by these other factors here. So it's really about us as naturopathic doctors trying to understand, okay, where's the starting point for this person? Where are the big drivers and triggers? And then as we address that, you're going to be addressing some of the other ones also. Everyone has a little bit of everything that needs to be worked on. We're not perfect. The world that we live in, there's all sorts of things happening, things that we're exposed to, that a little bit of everything we'll probably need to work on. But again, the big drivers and triggers we need to look at and assess. This one should have been, put a little bit earlier, but this is what I was referring to when things can be happening under the surface before symptoms arise. Think of, your health as like a bucket. And any of the little exposures that you have, any of these things, all right, you have some toxicity, maybe there's some mold exposure in your house, maybe you're not sleeping well, maybe your blood sugar is high and your gut health is messed up. All these things are drops in a bucket. And you might be able to tolerate things, especially when you're younger, tolerate some of these things that might not affect you right away. But over time, that water starts filling up. Your bucket starts filling up. And when it gets to the point where, you know what, more drop in the bucket and now starts overflowing, that's where symptoms arise from. That's where things start to happen. It's like, wait a minute, this seemed to come out of the blue. Well, it didn't necessarily come out of the blue. It was always there. It was always brewing over time, but you just didn't notice it. You weren't aware of it at the and this is extremely important because, sometimes we're even born with already our bucket partially full or mostly full. There's studies that babies are born with over 200 chemicals in their bodies already, just from what they call cord blood. When they're testing that out from the mother to the baby, they're already discovering 200 chemicals that the baby's already been exposed to just prior to being born. And so this is where it's real important to start early, even prior to getting pregnant, prior to introducing a life into the world, really starting early and maintaining it. Because it's much easier to work on prevention, much easier to work on things than to try to undo them overall. And I mentioned it earlier, all these things affect something inside of our cells called the mitochondria. And this is kind of an artist's rendition of it, but these are the little powerhouses you see here that are the energy producers of the body, and they dictate the health and life of the cell. If they're not happy, the rest of the body's not healthy. All of these, the mitochondria, they're considered like an organelle, or like a tiny little organ inside of all of your cells. All your cells have them, except maybe red blood cells. There's hundreds of thousands per cell. You have the highest concentration in the heart, and they're the energy producers of the cell. A lot of things can disrupt this process. All those things that you saw, those colored boxes, that terrain 10, all of those damage or affect how well these mitochondria produce energy. And they regulate the health and life of the cell. If they're not doing well, then they commit programmed cell death called apoptosis, and the cell dies. Or if they're not doing well, they're functioning abnormally, they can develop into cancerous cells. So the health of the mitochondria is real foundational to the health of the body overall. And we really deal a lot with this because a big portion of our practice actually deals with cancer. We use this same approach, the same terrain 10 approach, looking at what's the drivers and triggers, but we tailor it towards cancer patients. Cancer is a strong disconnection between how our body is functioning. All these terrain areas are really being affected by this. And so we use what we call the metabolic approach to cancer. And this is that metabolic approach to cancer is how your cells produce energy, how they get rid of waste products and toxins, and how they heal overall. So this approach, we use it for our cancer patients. And if you know someone who has cancer, you yourself has dealt with cancer, you know that a lot comes along with it, right? You're scared, you don't know what to do, you're trusting, doctors are not sure who to trust. I would say first and foremost, just wait, take a breath, don't jump into something that you're not ready to do. Look at all your options, gather all the data, look at everything together. And I would say, find someone who's trained, terrain certified, someone who can look at the whole picture, understand the why behind it. Because cancer is the same thing about any other symptoms or issues someone's dealing with. Why does it develop? Right? We don't want to just remove it with surgery or chemotherapy or radiation. While at times those might be needed, right? We still want to understand, what is your terrain telling us? If you just remove the symptom essentially of what your body was showing you without addressing why it developed to begin with in the first place, it's just going to reoccur. And a lot of the conventional treatments disrupt that terrain that we're trying to do. And so we really want to be selective about when we do them. Even natural therapies, if we do those at the wrong time, can actually flare things up. So take a breath. Don't be pressured by friends or family or other doctors to do something, especially if you don't feel comfortable in your mind with it. Because if you're not comfortable with it and you just go ahead with it, it's not going to help you. In fact, you're not going to get the benefits from it. So really get yourself a support system, your family, your friends, doctors who are open-minded, willing to work with you, because that's where the true healing is going to happen. And that's what's going to be the best outcomes overall. And this metabolic approach, we didn't come up with it. This was essentially enhanced and refined by Dr. Nasha Winters, who's another naturopathic doctor. She didn't come up with it, but really refined it to teach other doctors to understand, okay, when do we use certain therapies? How do we be more specific with what we're recommending? We're not 100% against conventional, but we really want to say, okay, let's be specific with it, as opposed to a cookbook approach of this is just what we do for our patients who are diagnosed with X, Y, and Z. So the approach that we take with it is, we want to test, we want to assess where someone's at, and we want to then address those areas. We don't want to just guess and start throwing anything and everything that's anti-cancer at someone. Because again, like I said before, some of those areas can be actually problematic for some people or cause it to be worse. So really want to assess everything overall. And then what this is that it's not a magic bullet. It's not a quick fix. It's really understanding, okay, what's your blood work telling us? Questionnaires, we look at genes and genetics, we evaluate your health on multiple levels. We really want to understand, how did you get to where you're at? So we'll ask things about, history in childhood. We ask things about what's going on with allergies and medications, past treatments and histories. We really want to get a full picture of it, and then help to create certain therapies or eliminate certain therapies that are going to be fueling the cancering process. In fact, that's how we refer to it. We refer to it as a cancering process because it is a process. It's not just, oh, I remove the cancer cells. Cancer is just your body's disconnect. It's essentially your own cells that have decided to disconnect and not listen to the rest of the signals coming from your body. They're not listening to it. So when the body says, oh, this cell's not functioning like it should be, we need to commit programmed cell death and replace it with a new cell, or the other signals that are allowing the cell to repair itself, that's a disconnect. So tumors are essentially just, again, another sign of the body that, hey, the body's trying to tell you something. Some part of your body is not listening and disconnected from the rest of it. And again, there's multiple reasons for that based on that terrain 10 areas. And then how does it work, right? Why does it work? We see it work because it works at that fundamental level. It works at that cellular level for supporting your terrain, supporting that all the cells of your body. When you think of terrain, think of a soil in the garden, right? If all you're doing is just pulling out weeds or just spraying weed killer on it, you're not going to get healthy plants. What you need to pay attention to is, okay, am I watering it? What type of water am I using? Is there sunlight? Am I tilling the soil? Is there good nutrients in the soil? What types of seeds I'm planting? That's how you know you're going to get healthy plants. And if you're just pulling weeds out, you're just spraying weed killer on it, you're just looking at the symptoms of what's happening. And again, not addressing that foundation for what helps the body thrive. So addressing all those areas, getting at that root cause. And this is why I know I presented a chunk of what we do is for cancer patients, but this is the metabolic approach to fill in the blank, anything, because it's so foundational. Metabolic approach to Parkinson's, metabolic approach to joint pain, metabolic approach to Alzheimer's, metabolic approach to heart disease, blood pressure, all these things, because when we address those foundations, we're addressing all health overall. So I tell people, we don't treat diseases. We don't treat any of these things, diabetes, heart disease, cancer. We don't treat those. We treat individuals that have those conditions, that have those presentations. we use that metabolic approach, we use that foundational approach to help and stimulate the body's healing process. So now I'm going to present a case. In this case, got approval from Stephen to use this case, but 51-year-old male, first came to see me in November, end of November. And he had some, general chief concerns, some past history effects with some AFib, some difficulty falling asleep, maybe some past history of, blood clot in the past. So I wanted to do more kind of preventative care and kind of assess, hey, where am I at? How am I doing, right? What we could call like a check under the hood, right? How are things functioning? Maybe you might have some, check engine light coming on. Really want to assess what's going on, but nothing major to start with. So our first plan was, all right, we want to get what we call comprehensive lab work, terrain lab work. And we do pretty comprehensive set. It's probably about, roughly 30 tests that we do to really understand where someone's at, right? We don't just want to understand one value. We want to understand what's the pattern that's being shown to us to really give us an understanding of, okay, is there inflammation happening? Is the liver and kidneys functioning appropriately? Are there certain nutrients that are deficient? Are there other factors we need to be aware of? So it's pretty comprehensive. And we have a different way of interpreting those compared to conventional. Our lab ranges are more optimal. So we're going to be catching a lot of things that they might be missing. So we gave them an order for comprehensive blood work. And then just some basic supports based on what I heard in the history. Him telling me, started to give some basic support, some education about what to start doing from a naturopathic perspective. And then he was supposed to kind of return in roughly 4 weeks to see what the labs were showing, as well as then come up with a more detailed and specific plan. And this is typically how it works for most of our patients. They come in, we go through history, get an assessment, they get some stuff to start working on and doing, as well as getting some lab work, and then they follow up in roughly about a month to then get more specifics and see what some of the lab work is telling them. So that was it. End of November, came back, in December, and to kind of get reassessed with some of the lab work. And this is, part of the labs that we did. It's not all of them, but these are the ones that were significant that we were looking at to understand, again, where someone's at in their health. And the ones that were significant, I put them on here. There were some other ones that it wasn't out of range and everything was looking good. So when we look at these, we assess it and look at it from a different perspective. So the ones that are in yellow here means they're out of range for our what we call optimal lab ranges, meaning that the optimal lab ranges means that these are the ranges that most people should be in. Side note, unfortunately, the ranges that are put on labs that you would get back from a doctor, those are the average for the population in the area you're being tested, not necessarily optimal. So you can go to one city or state with an unhealthy population, and you can have wide lab ranges and be classified as, hey, everything's great, nothing's going on. Or you can do this exact same labs in a healthy state or population. And because they're narrower, because of the population that goes there, you might be classified as having diabetes. Well, we don't like that approach. We want to say, regardless of where you're going, whatever state or city, and I've even seen different lab ranges within the same city, different labs. We want to see, regardless of where you're going, where should you be optimally for both kind of prevention and optimal wellness. So when we look at these, again, a lot of these might fall in the range of, hey, everything's great. And you might even, maybe your doctor or someone said, hey, all my labs are normal and they can't figure out what's going on with me. Well, it might mean that the normal that they're using is the average American population. Well, and we know the average American population isn't optimally healthy. So I don't want to be compared to that average. So this is, again, not us specifically, but us in the holistic sense of doctors and practitioners have established these are where optimal ranges should be for people. So when we look at these, and we see a lot of yellow here with things that are being typically higher than where we want to see them. Some of the values with triglycerides, this one we'll see where we want to see it. We typically want to see that below 90. That speaks to, okay, we got some blood sugar, maybe some thyroid stuff going on. The body's inability to process, fats in a certain way. We got blood sugar, so glucose, 112. That's what we call a fasting level, meaning that that's what it is pretty much on average even when food's not being consumed. And that's quite high. We want to see that below 85. Then we look at some other values. Hemoglobin A1C is another blood sugar value, right? At 5.7, we were looking at, conventionally they would call this pre-diabetes, but this is a measure from the previous 3 months of how high blood sugar has been over those previous 3 month time period. We also look at something called LDH. This is a marker we look at to see how well your cells are metabolizing, the cell membranes. If they're being destroyed or if there's inflammation happening with them, you're going to release more of this, and it's going to be higher. So we want to see this between 135 and 175. Up 199, there's definitely some stuff going on here that we got to address. And so on. We got really low vitamin D at 24. Our optimal values are between like 60 and 80. So we know we have some low vitamin D and some other values that are a little bit out of range here. So this is what we came through, saw, okay, we got some work to do. This was the end of December. And gave him some more plans to do, some other more specifics based on what I saw here. Okay, great. Now we know what we're dealing with and what we have moving forward. So during that period of time between here and when we kind of meet back up of roughly about 12 to 14 weeks, we get some foundational support, some naturopathic support. So these would be things like making sure we're drinking enough water, making sure we're getting to sleep, making sure we have maybe certain nutrients like magnesium. We're looking at testing and assessing to really see what's happening. Nutrition and dietary changes. This is a huge one, because it doesn't matter how much supplements you're taking or other things you're doing. If you're still putting things in your body that your body can't use, or that's going to be causing more inflammation or toxemia in the body, it doesn't really matter. So definitely need to hone in on diet. Okay, what's going to be the best way for this patient to heal and start correcting those things. And then lifestyle changes. So again, sleeping habits, castor oil packs, exercise, all these things. Certain supplements, so a handful of supplements to help optimize cell function and as well as replenish certain nutrients. Certain homeopathics, which are great for stimulating that self-healing of the body. So a few of those things. And then that was, probably about 8 to 10 weeks or so doing that. And then we would do some follow-up tests prior to that, prior to meeting up again. So from that, end of November to what about, I believe it's mid-March, these were the first labs that happened, right? End of December, that was when it was measured. And then these are the ones for March 16th. So you can see that the major drastic improvement with all these values coming down in our range. So on the right-hand side here, you see the optimal ranges of where we want to see these values. And then we see all the corrections that happened with these values in here. So look at that. LDH came back down right, within the range, almost maybe a slightly too low. Had a major improvement with the size and shape of red blood cells. He was having too many components of red blood cells before. That was putting stress in the system. Now all the way down. Triglyceride, look at this, went all the way from 192 to right within our range, back to 68. Cholesterol, we have a different way of doing cholesterol, but that came down to a healthy range as well. These values in here, this one's a really significant one, this GGT. This is a marker that we look at to see how well your liver can handle detoxification. It refers to the glutathione, which is the master antioxidant detoxifier. And if this level is high, over 15 for us, that means your liver's straining a lot. There's a lot of toxicity, a lot of oxidative stress that's happening in the body, and we need to start supporting that and correcting that. It was at 47 before. We want to see it less than 15. Whoop, dropped it all the way down to 16. So whoops, excuse me. My lights went off here. Apologize for that. When they're not moving around in the next room, my lights go off. So major improvements here. And then even look at the insulin. So insulin, glucose, and hemoglobin. This is the really big improvements. So we have glucose, which is blood sugar. That's just floating around in the blood. We have insulin, which is that key that unlocks the cells to allow the body to receive the insulin. And when we see it, elevated at 14.6, our value, we want to see it between 3 and 5. This means that more and more insulin keeps being pumped out into the body, and the cells just aren't listening to that signal, right? So you have what we call insulin resistance. Your cells are resistant to that insulin. They're resistant to that key to unlock the cells. So the body has to keep pumping out more and more, and glucose keeps rising. And there's a lot of other factors of why glucose is damaging to the cells and the blood vessels, and causes a lot of changes, damage to those mitochondria we were talking about before. And then the hemoglobin A1C. So look at that. Within roughly 3 months, maybe a little bit less, we have them all dropped down into our optimal ranges here, which is significant. This is great. So this isn't necessarily a testament to what we do. We guide, we give you the tools and understanding of this is the approach that we want to take. But this is a testament to the patient, right? Because many times I give people plans that they can do. It really comes down to that willpower, as well as that, yes, I'm going to stick with this. And so this is significant. This is, I would say this is not a typical result, but it can be for most people within that 12-week time, correcting all these numbers and dropping them down. TSH refers to the thyroid, so that came down within an optimal range. All these just by following the recommendations with the diet, which was a huge one, as well as, again, some of the supplements to help enhance that process overall. So what do you do? Here's some basic things, basic takeaways. Again, these are some foundational things that pretty much anyone can do for the most part, that don't have to be as specific. But diet and nutrition, one of the biggest things in society, unfortunately, is that we eat too many processed carbs and sugars and starches. And these are things even that we would consider maybe healthy. So even, fruit, unfortunately, and fruit juice is high in sugar and carbohydrates. And so we have to minimize those. So minimizing or eliminating the carbohydrates and starch intake, that's going to go huge. These comes from things like grains, so rices and corns, starchy vegetables, beans and legumes. Those tend to be higher in starches as well as hard on digestion. So in general, limiting those and minimizing those do big wonders for the body, because again, we're targeting one of those terrain aspects of blood sugar, which the majority, probably 90% of Americans, have an issue with blood sugar, right? And whether it's officially diagnosed as diabetes or not, there's definitely something happening there. Making sure you're drinking pure, clean water. So filtered water, making sure it's clean. Water, unfortunately, can legally have lots of things in it, lots of toxicities, whether it's hormones or your neighbor's medications or things. The water systems can't treat that. It's very expensive to remove those. So they're just removing some of the main aspects of it. They're making sure there's no bacteria growing in it, but they're not actually paying attention to the heavy metals, the pesticides, the hormones, all those things that can be in our water. So when you're drinking tap water, you're getting all the things that are in there from that, and that's affecting your own health. So really making sure you're drinking good clean water. Moving and exercising throughout the whole day. The patient I just presented that case wanted me to say he wasn't even doing that. All he did was follow the diet and correct things. But I would like him to do that because, again, there's a lot of benefits to exercise, increasing circulation, supporting the heart, increasing immune system function. So movement every day. I know some people are afraid of the term exercise. I just want people to be moving. So whether it's taking the stairs instead of the elevator, getting up, frequently throughout the day if you're just sitting down, doing stretching, moving around throughout the day, that's going to keep the blood flowing, keep the lymphatic system going, and really supporting overall health and longevity. Making sure you're sleeping, getting to bed before midnight. Ideally, that's when you are getting the deepest sleep, if you can get to bed between 10 and 11, and exposing yourself to bright light in the morning to really wake you up and set that circadian rhythm together. Earthing and grounding, which is not a common concept for people, but that's essentially just getting in direct contact with the ground, bare feet or sitting or laying on the ground, at least 15 minutes a day. Sometimes they even have devices you can plug into the grounding outlets of your house or put out the window to really ground. That helps with reducing inflammation, giving your body those free electrons from the earth that act as like antioxidants. And then breathing. Unfortunately, breathing, we're supposed to be breathing through in and out through our nose, not necessarily our mouth, because there's a lot of other effects that has. So practicing breathing through the nose and learning to breathe through the nose on a consistent basis. These are, the top 6 things I would say are going to be really helpful just to start establishing those foundations for optimal health. So how do you work with us? How do you contact us? Well, you got to contact us at these phone numbers or the website. We have a lot of great information on our website. We do work virtually as well with people, so you don't necessarily have to be in or near us to have our services. We help patients all over the globe. Dr. Aaron is the founder of the clinic, Option Naturopathic, and myself, and we're both naturopathic doctors. So if you're interested in understanding more about, okay, what does this entail? What are the costs? What other programs that you have developed? You can go on our website or give us a call, and we can talk you through that. I do want to leave you with a final quote before we take some questions. You are only getting one body to live with, and no one cares more about your health and well-being than you. 1 year from now, you will either be healthier or sicker. You are deciding that now. What are you going to do about it? Questions?
Do you produce the supplements yourself, or do you purchase them elsewhere?
Good question. So no, we don't produce them ourselves. We go through reputable companies that are provide them to professionals, professional formulas. Any other questions?
It sounds like in order to get the round of tests done, one needs to actually visit the office, or there's labs done locally.
Yeah, not necessarily. So we will give you like a lab order that you can take into either your primary care provider, or we can give you a lab order that can be taken. There's a lot of draw sites around the United States that you can find the one closest to you and get those labs drawn. So no, you don't necessarily have to visit us, because we don't do the lab draws or blood draws ourselves. We will direct you to a lab site that you can get them done.
From my experience, I was able to use my insurance to do the lab work.
Yep, some insurance will cover that. Yep.
So some of it, I mean, they would have been, it did go through the insurance. So for us.
Yep. Everyone's different with those. Some insurances will cover, some won't. We always tell people, do as best you can to essentially get them for free or nothing at all. With regard to trying to go through insurance or through a provider who will order those tests for you. Many times they might not, just because of the extensity of the tests, and they might not know how to interpret them, so they don't want to run them for you. But whatever you can do, get as many as you can through your insurance. If not, then come back to us. And oftentimes we have out-of-pocket cash-based labs that are far cheaper than sometimes even going through insurance. So there's always a workaround we can do for that. Anyone else?
I'm really impressed with this. I take some supplements. I try to be careful that I'm not getting a lot of fillers in what I take, but it's real difficult to determine reputable companies. And I also use some essential oils as well. I'm on some of your basic medications for cholesterol, hyperthyroidism, and high blood pressure. And I really dislike taking what I consider to be toxic chemicals into my body. So this is really enlightening, and I'm going to check out your website.
Yeah,
But
please do.
I think I'm probably going to reach out to you because I haven't felt good for 10 years. And this sounds, I'm really amazed by the change in Steve's readings. I mean, his test, that was impressive in a short period of time.
Yeah, very, very great. And there's a lot, just kind of going off of what you said in the very beginning of, taking supplements. That's great. But what we like to do is to make them specific to understand okay, do you need this, or how much do you need? And really kind of tailor it to, okay, based on certain medications that you're on, or what's going on in lifestyle and what we're seeing in labs. We can then be, okay, say you need this over here, and kind of really focus and hone in on, you know, what you're using, and if that's appropriate for you. But yeah, please check out our website. We have a lot of good information on there, and any of the staff here will be, you know, more than happy to chat with you if you had more questions on that.
I'll
Thank
pass
you.
out your card, okay? I have
Oh
your card.
yes, I
Great.
believe I mailed some out there too as well.
Yeah.
Perfect. Anyone else? Other questions, comments, or concerns?
Thank you.
All right. Well, I
Yes,
really,
thanks much.
really appreciate the opportunity. Sad I can't see you, but thank you for the opportunity, and you can pass on that to everyone else as well. And then I'll be in touch to, you know, get the recordings and see how everything went for it. So really appreciate you guys' attention. Thank you very much.